Hello, I'm Dr. Klein with Potomac Urology. In this video, we're going to walk you through what to expect in the weeks after your aquablation procedure, what to expect during your recovery. After your procedure, you will awaken from the anesthetic in the recovery room. There will be a catheter in place draining your urine. There will also be a sterile saline solution being infused through the catheter in order to prevent blood clot formation and to allow your urine to run clear. In the hours following the procedure, the Potomac Urology team will make the decision as to whether it is safe to stop the saline solution infusion and prepare you for discharge. While more than half of our patients after aquablation will be able to go home the same day as surgery, others may need to spend one night in the hospital to continue the bladder irrigation and clear their urine. In either case, your Foley catheter will likely be removed the first day after your aquablation procedure, whether in the hospital or in our office. The first day after your aquablation procedure will be a busy one. If you were given steroids or additional antibiotics after the PAE procedure, you may stop these after the aquablation procedure and do not need to continue them. You may take pyridium as prescribed for urinary burning. You may take pain medications as prescribed or Tylenol for the pain. However, you should not take NSAID medications such as Advil, aspirin, or Aleve, as these can make bleeding in the urine worse. You may stop any medications you were taking for enlarged prostate prior to the procedure, such as Flomax or Uroxetrol. Your urinary catheter will likely be removed the first day after your procedure. If the catheter needs to stay in longer than one day, your surgeon will likely give you further instructions after the procedure. Prior to removal of your Foley catheter, you will need to maintain the catheter. You may need to irrigate the catheter with sterile saline solution to prevent or remove blockage from blood clots. You will need to drink plenty of fluids in order to keep the urine as clear as possible and dilute out any blood. If you have a condition which limits your fluid intake, please let your surgeon know prior to your discharge. The catheter bag will need to be emptied every 4 to 6 hours to prevent overfilling and backflow. You will be given instructions on all these things prior to your discharge from the hospital. In the first 2 to 3 weeks after your procedure, after the catheter is removed, you'll continue to see blood in the urine. This is normal. Continue to drink fluids in order to keep the urine dilute. And remember, it only takes a small amount of blood in the urine to dramatically color the urine. It always looks worse than it is. While it may appear scary, blood-tinged urine is not dangerous. It is also normal for a red flash to occur at the start of urination, followed by a gradual clearing of the stream. Regarding blood thinning medications, you may restart any blood thinners and NSAIDs after the midstream urine is clear, even if that red flash or a few drops of blood at the start continues to occur. Be sure to discuss plans for resuming any blood thinners or aspirin with your surgeon or our nurse practitioner prior to your procedure and certainly prior to discharge. You may also notice occasional burning when you urinate. This is not of particular concern. Men can be controlled with pyridium. There are several reasons to have concern. If you have blood clots in your urine, if you are unable to empty your bladder when the catheter is in or after it is out, if you feel weak or dizzy, if you have fevers greater than 100 degrees Fahrenheit, or if you have worsening burning or pain over time. Please call Potomac Urology if you have these concerns. In the first 2 months after your procedure, the issues start to change. Blood in the urine will usually be gone by 2 to 3 weeks after your aquablation. Your stream and emptying will likely improve significantly in the first week after the procedure. However, irritative urinary symptoms may persist for longer than that. These symptoms include running to the bathroom urgently, frequently, or nighttime trips to urinate. These symptoms are a result of a thickened, less stretchy bladder wall due to your prostate blockage. As the bladder heals over several months, these symptoms will improve or disappear, but may take a while. This will improve over time, so please be patient. After their aquablation procedures, many patients wonder when it is safe to return to sexual activity. It's safe to return to sex after blood in the urine is gone and 2 weeks have passed since your procedure. Aquablation is very unlikely to affect your erection quality. Most men will still be able to ejaculate fluid during orgasm after aquablation. However, about 1 in 4 men may have a decrease in the volume of semen or absent semen during orgasm after aquablation. This may be temporary or permanent, but will not affect your ability to have sex.